Cancer. Everyone here today has heard of the word cancer, and you may even know what it means. But do you know all the different types of cancer that's out there? Today I want to share a certain kind of cancer with you that I became familiar with in the last 8 months. Synovial Cell Sarcoma. With my research from cancer.net, approximately 11,280 people will be diagnosed with this cancer in the United States this year. More males than females. Although my topic may not affect you now, it may affect someone you know, like a family member, a friend, someone in passing. And from my information, I want you to be able to help them understand. Synovial Cell Sarcoma is a rare malignant tumor that grows in the soft tissues in the body. It also can connect, support, surround structures and organs in the body. I am first going to explain today how synovial cell sarcoma is detected or diagnosed, signs and symptoms, treatment, with the effects of chemotherapy. Synovial cell sarcoma is diagnosed by taking a piece of the tumor or the mass, wherever it may be located, and looking at it under a microscope. And by doing this, the doctors will see a rearrangement in the chromosomes. And if the chromosome X and number 18 are present, they will be twisted together. And this is how synovial cell sarcoma is detected. Now that I've said that, moving on to signs and symptoms. Signs and symptoms of synovial cell sarcoma, you may see swelling. You may see a knot or a mass, could be associated with or without pain. You may notice limping of the limb, like the leg, from the tumor. Synovial cell sarcoma usually starts in long bone areas like your legs and your arms. With that being said, I would like to talk about treatment. Treatment comes in 3. You have surgery, radiation, and chemotherapy. Surgery is just the surgical removal of the tumor, all or part depending on the location. Radiation is a high energy wave, rays that penetrate the skin. Could be topically, it could go all the way through from one side to the other. Chemotherapy. Chemotherapy is a drug that is administered through the bloodstream, and this is just to kill out the cells, to keep the cancer from getting bigger or reproducing. With that being said, I would like to share the side effects of chemotherapy. From my research from the Cancer Institute, I was able to pull up a fact sheet that explained this to me. Signs and symptoms, of course, are nausea and vomiting, just because it makes them so sick. You have diarrhea, constipation from pain because of the pain meds. You have hair loss. Wherever you have hair, it's possible it can go. You have redness of the skin, and that's from the radiation. But you have increased sensitivity to sunlight. You also may have increased sensation to smell. Everything may smell bad. The biggest one of all that we noticed with our son was how it affected his blood system. The chemotherapy that he was administered affected his white cell count to where he was at risk for infection. Because, like I said previously, not only does it affect the bad cells, it eats your good cells as well. It also affects red blood cells. The red blood cells are stored in your bone marrow. And with this chemotherapy, if it takes the bad, it's going to take the good, even with the red blood cells too. And this causes you to be fatigued, anemic, you just feel tired all the time like flu symptoms. And this leads to transfusions. And my son had 3 throughout his whole treatment. It also affects platelets. Platelets are your clotting factor in your body, and if this is low, your blood's not able to clot like it should, like it would have before. and it will cause you to bruise easy. I have shared with you today some main points of synovial cell sarcoma. I talked with you how it was detected, signs and symptoms, treatments, and the effects of chemotherapy. With my information today, I am hoping that you will be able to help someone else, maybe in passing, a friend, a family member. Thank you.